love working with our trainees. They are just so brilliant, smart, and creative. They keep me on my toes, so I learn from them as much as I'm trying to pass my knowledge to them.
I think one of the unique features about this program is the very well-balanced mission in education and service.
The pathology and the clinical presentations that you see as a trainee here are really unsurpassed.
Our program is also very fellow-centric, so we do early career development at the beginning of the fellowship. So I think that helps, and I think the fact that the fellows know that we all care about them helps them to grow.
It is quite unique to get to be a resident or a fellow in a place with, that's attached to a very big university that has a lot of opportunities and has a lot of research.
Research is really important to a fellow, especially anybody who's looking to go into an academic career. And here in our ID division, our fellows go to our national conference every year. Our work is accepted, and we always get the trainee awards from our division.
Despite there being a pandemic, we were able to grow the size of our fellowship, to provide more research and elective opportunities for our fellows. We were able to create an entire Women in GI Health Center, despite there being all of these challenges and setbacks. And I think our program really rose to the challenge.
I think it's important to find people who are invested in you and who you want to be as an individual, both inside and outside of the workplace, right? Because I think that's really what defines you as a physician, is not just the work that you do here, but the person that you are outside.
The environment, the feel, the devotion that my colleagues have to teaching and education is really what inspires me to keep doing what we do.
My senior fellows were very supportive, if that required, a FaceTime call at 3 in the morning when we were lugging a cart, to do an emergency procedure. That was something that struck out to me.
We went to medical school together, actually, and then we trained together, and now we're chief residents together.
Transitioning from being a medical student to a physician, I thought that tradition, everyone talks about the transition being really hard, but I felt very supported by my attendings, my senior residents, and the fellows whenever I got consulted.
Not many centers have a dedicated autoinflammatory disease clinic, which we do, and then we see many of the rare diseases.
I was able to see amazing pathology here due to the diverse patients we see.
We've been here only 3 months so far, and I consider myself very fortunate because I worked with some of the most amazing co-residents and seniors and attendings. We're not just told to do something, we're explained why we're getting a certain imaging done or certain lab work done. What are the differential diagnoses that we're thinking about?
I could say whatever's on my mind, and even if it's wrong, I get feedback on it.
By default, have to go to a noon conference every day, and the diversity of topics that we talk about covers the bread and butter of medicine, and also goes into the zebras, which is only benefiting our education.
And really delve into particular medical topics that we feel like would be beneficial for everyone to learn.
Stony Brook's given us the tools to not only learn, but to know that you always need to continue learning.
Everything is geared toward education in this program. In addition to become a great doctor.
We really make sure that it's hands-on and that people can practice in real time.
If you have an idea, the faculty here will mentor you and help make it a reality.
Not only do we have a very diverse patient population, but also within the hospital ourselves, we have a lot of teaching going on. So internal medicine residents rotate with us, emergency medicine rotates with us as well, and even anesthesiology residents rotate.
We offer a nephrology critical care track. It's a track that has a dedicated curriculum. You do 2 years of nephrology and 1 year of critical care, and then when you finish, you have the career opportunity to become both an intensivist and a nephrologist.
I wanted the opportunity to have a strong foundation in transplant patients as well as peritoneal dialysis.
Because of the fact that we have all these disease-specific doctors and attendings to work with, we get to learn a lot of nuanced details about cancer and exactly how to treat different types.
We have gyn-oncology here, we have thoracic oncologist, we have GI oncologist, and sarcoma specialist too. There's so many research opportunities in Stony Brook from the hem-on perspective. We have so many clinical trials that we can participate in. If anybody wants to do a lab research, you can find an opportunity too.
We're very fortunate that we have a brand new hospital, we have brand new ICUs, a brand new pediatric hospital, and a brand new cancer center.
We have all state-of-the-art facilities in cardiology. We redid all of our cath labs, and we have actually a brand new cath lab, EP lab. We have all state-of-the-art machines in the echo lab, and our fellows actually have a brand new echo machine that they love. And our electrophysiologists also had their electrophysiology lab all redone as well.
As someone who's procedurally inclined, we have a really high procedural volume. We see a ton of patients and interesting cases, giving us the best opportunity to develop our skills.
My favorite thing about Stony Brook is that we're taking some of the most cutting-edge technology in cardiology and combining it with the quality care that we deliver here to help ensure that our patients have the best possible outcomes.
The best thing about ICU at Stony Brook is the 20 ultrasound machines that we have. We're able to ultrasound everyone, do cardiac exams, lung exams, abdominal exams. For me, it's great because I become a well-trained, well-rounded fellow that I'm able to go anywhere. Like even now we're being recruited for other places that would love to have us because of all these things.
We have great mentorship and great exposure to the different communities where we can reach out to our geriatric patients.
We love to decompress with each other. That could involve going out for food.
I love walking around the parks. I love playing volleyball, whether it's beach or indoor.
You're always near the beach, whether it's the North Shore or the South Shore.
I like to go to the vineyards.
Beautiful campus. I love walking around here. We have beautiful gardens.
I love Stony Brook because of the wonderful curriculum as well as the brilliant individuals.
Stony Brook is a place where you innovate.
I love Stony Brook because of the people and their commitment to the community that they serve.
I feel like I belong here.
Whenever we work together, we do everything in tandem. Yeah, they call us the dynamic duo. I mean, he's just like a brother to me.